Channel 5 Network, this is MorningLine with Nick Beres.
Good morning, everyone. Nick Beres here. Thanks for joining us on MorningLine on this Wednesday. A good show on tap for you. Hopefully we can educate you, answer some of your questions, give you an idea of what Medicaid expansion would mean. Medicaid expansion is something that has been discussed here in the state for years, and we're about to get a new governor. And could things change? Where do we stand? Are you a little bit confused? I guess I am as well. But what will happen here could affect an awful lot of people on a lot of levels. And that's why we're going to talk about it this morning. As I said, take some of your phone calls, but with our guests, I think who can maybe lay this out in a way we all understand it and help you make up your mind where you stand on the issue. Michele Johnson is with us, Tennessee Justice Center Executive Director and co-founder. It's nice to have you on, as always.
Thanks for having me.
It's good to see you. Linder Salter is with us as well, and she is a Tennessee Association of Alcohol, Drug, and Other Addiction Services, the Executive Director there.
I am. Just Thanks. Say TATUS, it's shorter.
That's easier.
Okay.
Yeah, we're going to say TATUS for now. Thank you for coming on.
You're
Appreciate
welcome.
it. You know, as I said, it can be a little confusing for folks. What the status quo has been for several years, what this state decided to do or not do, if you will. Michele, is there a way you can lay that out for us in a bit? Just assuming there's some folks out here who are still confused and not sure, okay, what we're talking about here.
Yeah, I mean, basically 31 other states have accepted federal funds to cover all of their citizens. And so in our state, Governor Haslam pushed a plan that was uniquely Tennessee to take federal funds and cover these folks who are working poor, basically the waitresses, construction workers, home health aides, about 280,000 of those folks in our state who right now are not getting coverage. The legislature rejected that. And what's happened is that we have now lost $5.6 billion of federal investment to our state. We're #1 in the nation at hospital closures.
That's just money we didn't get that we could have had.
Free money that would have covered home health aides and waitresses and construction workers who now are going without care or who are losing, who are going bankrupt. I think apart from the folks who are uninsured, we got to also see how that's impacting all of our premiums. So in states that expanded, their premiums have grown at everyone's have grown at a slower rate. And so Tennesseans are paying more than people in Kentucky and Arkansas for health insurance, privately insured folks.
You know, people are sitting there listening, and they've heard that part. The state and the governor had his own idea of what he wanted to do with that money, made that proposal, and it was not approved. And so it's like, well, if you don't do it our way, the federal way, you don't get anything at all. And they're wondering, okay, why could there not have been a compromise? Or why on earth, if your plan wouldn't go, would you still say no to all this free money? And look, I know you don't want to get there. There's a lot of politics involved. But, I mean, can you give them a reasonable explanation as to why something wasn't worked out? Why do you think?
I think it was about politics. I think there's no question it was about politics. Legislators were asked again and again, you don't like Governor Haslam's plan, come up with your own plan. Now we're 4 years out. 31 other states have found a way to dislike the president and the former president, and also to take that federal funds and cover their folks, and also to stabilize our healthcare infrastructure. So as these hospitals close, because we have growing uncompensated care, rural Tennesseans are losing jobs. And if you happen to have a car accident or you have a parent with a stroke in those areas that have no hospital, you know, basically that's a life or death situation.
Sure.
So we really need legislators to roll up their sleeves and solve these problems, and to put aside politics and to focus on their constituents. So we shouldn't be #1 in the nation at hospital closures, and there's 30 more hospitals at risk. It's just not acceptable. We can do better.
And is there? And go ahead.
I think it might be important to point out too that Medicaid expansion plans, those 1115 waivers and such, always are tweaked at the federal level. So there was always an opportunity to make it fit the situation.
Okay, and for whatever reason, politics or otherwise, it wasn't done. And okay, can you give me an idea just how many maybe Tennesseans were, you know, affected by this?
Yeah, so Governor Haslam says 280,000 would get health coverage.
Okay.
But all of us are impacted because we're paying more for our health insurance than we would have if we basically had expanded. So as 31 states have done this, we can see it's a natural experiment. We can see uncompensated care numbers in our state much higher than other states. We can also see things like maternal mortality and infant mortality. We're doing worse than states that expanded. Also, the opioid crisis is worse in our state than states that have expanded. So we have a leadership failure that's resulting in health consequences that are real, and they're not political. They're just, it doesn't matter if you're a Republican or Democrat. If you are losing a child to an opioid addiction, or if you're losing a daughter because she had a baby, it shouldn't be that way. We shouldn't have life expectancy going the opposite direction in Tennessee. We can do better.
Is it really going the opposite direction?
The opposite, yeah.
People are dying earlier.
They are.
Yes.
Ugh, Mary Linder, I know one reason you wanted to come on, among other things, is what you just touched on, obviously, with what you deal with, the opioids. And it's an epidemic here now, and it's Tennessee, she's right, it's one of the worst. So if there was a Medicaid expansion, how would that help things?
Well, we have seen significant federal and state funding come into Tennessee to deal with some of the addiction issues and specific to the opioid crisis. But our level of funding previous to that roughly treated about 10% of the people who needed treatment. With that expanded funding, both federally and state funding, and that includes a brand new allocation by the Haslam administration during this past session, we're just edging over 20%. So we have a huge unmet need. We have waiting lists. We have people who are desperate for treatment. And I know we're going to get to the Red Line later, but
yes, sure,
we staff the Tennessee Red Line, which is an addiction treatment referral hotline, and I know how many calls we get every day of people who are desperately looking for treatment, who are on every waiting list in the state, who are trying to figure out how to navigate a system where they don't have coverage, they don't have access to any kind of health plan, and even sometimes people who have access to health insurance, whose health insurance will not actually pay for the care. So it's a huge unmet need, and it's something that we deal with through the Red Line every day. And
so tangibly, these folks who are calling and they're on a waiting list, these are folks that are addicted to an opioid, dealing with that?
Or other things.
Or
sure.
other things. But so without that help, I mean, people are dying.
People are dying. They're certainly, at risk of all kinds of other things. Many people are, if their access to a prescription is limited, for example, they often move on to street drugs, which are often used intravenously, which exposes them to risk of hepatitis and AIDS and all kinds of other things. It exposes them to crime and victimization. Many of the women are, trafficked and other things in order to be able to meet their need for an addictive substance. So yes, I mean, there are all kinds of social consequences. There are children who are not parented because of these issues. There are grandparents who are taking care of children because of these consequences. Our jails, our hospital ERs, all of them see the consequences.
I guess, as we sit here talking about it, I just wonder if it's a combination of, how people, the public, and it comes down to getting public, sentiment on the side of this, are not in favor of just taking this basically free money. I'm trying to get a handle on why, if the public gets behind this, then the lawmakers that are elected by them, I think, would take a hard look at it. How is it that it hasn't created more of an uproar among, obviously the people who benefit are saying it, but the other folks like me, like, I don't know that I'm going to benefit from Medicaid expansion. I probably won't directly. You're right, other ways. But how come it's not hitting there?
I think the public has been overwhelmingly supportive of it across party lines.
Okay, so the polls are saying such. So how come that doesn't translate with the lawmakers?
Yeah, I think because the lawmakers are focused on being primaried on the right. They're not focused on necessarily governing, and that's, I think, a real crisis, because there is no legislator who, if they get into the general election, wouldn't have more people for this than against it. But in the Republican primary, that's a different thing, and they can make a caricature of people's votes. And so there were a lot of courageous Republican legislators who said, we want this. We have to have it. It's the right thing to do, and it's also economically beneficial for our state. And there were very many that felt that but wouldn't say that. They were afraid to say it and stay in office. And so, we really need elected officials who are much more worried about the health crises that our state's facing than staying there, I guess. I mean, I think that Tennesseans will appreciate that, and they'll find a way to have their back. I think it's also just important, a couple of other categories of people who folks might not know. Students, for instance, if they make less than $12,000 a year and their parents don't have health insurance, you know, for them, students are in the coverage gap. So you have kids who have beat all odds to get to very impressive colleges, and they don't have health coverage. And so if they were to break an arm or, you know, be in a car accident, they would probably bankrupt their family. It makes no sense. Another category of veterans, 24,000 veterans. So they've risked their life for our country, and we can't take their free money to make sure that they have basic health care. Domestic violence victims, you know, their husband has health coverage, they're fleeing a situation. If they don't make $12,000 in a year, they can't get the health coverage they need to get their, you know, basically, you know, how they were battered fixed, or the mental health services they need. So those are just 3 examples of groups that if legislators, you know, basically share the values that they say they do, they would find a way to take the money and make it happen.
I agree. Listen, it's just mind-boggling. We're going to take a break on that note. We'll take some phone calls. We'll get into more details with our guests about, you know, what the chances are of something maybe changing. Whoa, wouldn't that be nice? We'll take a break. Be back with more right after this. Stay with us.